Today we are honored to welcome Dr. Decubellis to the show today. I'm very excited about this. He's a chiropractor and he really helps people take control of their nervous system. As we were talking about before the show, the nervous system is really how we experience reality. It's the foundation of our life and it's out of alignment. We're kind of out of alignment in our lives, metaphorically, right? And he really knows the stuff and comes to all things nervous system, cervical spine especially, and he's helped many people get to help and improve their overall wellness, as chiropractic is amazing therapy. So I'm very happy to have him on today. How are you?
Good. Thanks for having me.
Definitely, man. I'm very interested to hear your story, how you got into this and helping people as you are today.
Yeah. When I I grew up in a kind of a family of chiropractors, so I was experiencing it at a very young age. Knew I wanted to do something in medicine, but I really liked this process of being able to physically help people and see the changes instead of just giving them medication and hoping you never see them again.
Good, man. I like it. So it sounds like you're not just interested in giving people medications, right? I mean, of course, they have their place in certain things, but you really want to help people actually take control of their wellness overall. Is that right?
Yeah, definitely, and be able to see and track that progress. That way we can see what's working, what's not, but also make sure if for some reason the issue comes back, we know what steps to take to get rid of it as quickly as possible.
I love that because it's kind of like a measurable thing, right? If we don't measure it, we can't really manage it in a sense.
Yeah, 100%. And that's what we're all about because my goal is always we want to try to treat things once, get the best possible results we can, and that way this doesn't become an ongoing issue that we're seeing them every 6 months, every year for.
Yeah. Like, what do you see some potential problems with conventional care that they're not addressing? Like, what would you like to see, and how can we start to advance in that direction?
I think the biggest problem is that really the whole foundation of how things is built. And what I mean by that is, let's say someone has neck or back pain, they go to their primary care doctor. They don't treat those things, so they're not really sure what to do. So at that point, they typically will send them a referral to physical therapy. At this point, though, they've only got a diagnosis of neck pain or back pain or whatever pain it might be. That in itself is not a diagnosis. That's really what you came in, your complaint was. That's what you said you had your issue is. But we don't know what's causing that pain. Is it muscle, tendon, disc, ligament? We don't know. So the problem is then when they go to physical therapy, they just do neck pain stretches and exercises or low back pain stretches and exercises. And all their goal is to strengthen the body to compensate for whatever the issue is. So it doesn't actually correct anything. Because very, very rarely is someone having low back pain because one specific muscle group has become weak. For that to happen, there would have had to have been an injury at some point or really, really bad posture for so long of only one muscle becoming weak, which is almost unheard of. So just the whole process of how that really is treated is not ideal, and it's not really beneficial to a person. It's more of, again, getting them to come in, hopefully getting them relief for a while, and then hoping you don't see them again for a couple months.
Got it. So it sounds like muscle imbalances are potentially the cause for a lot of back pain. Do I have that right?
It's muscle imbalances and posture and biomechanics. Those three things are one of the foundational issues that cause these problems.
Got it. Can you define biomechanics? I haven't really talked about it in a whole lot of detail in the show. Yeah, just define what that is and perhaps how we can optimize it in our own lives.
Yeah, so really with biomechanics, we're talking about the way that the body moves and how each muscle, each joint, tendon, ligament, all of them have a job, and they all have to work properly. Because the way your body is designed is that if one fails, you don't just break down. Your body will find a way to move and compensate for that. But the goal is that you only want to compensate for a short period of time while the area that's not moving properly heals, because when you start doing it for long periods of time, you actually change the way that you move. You change your biomechanics and your posture. And the problem with that is that when we do that, we start shifting the way that your body holds your body weight, whether it be your head, your neck, your body, your arms, all those things. It changes the way you hold your weight, and parts of your body start to break down due to abnormal weight bearing. And that's why we start to get like bone spurs and degenerative disc disease and things like that. It's abnormal weight bearing and movement patterns and biomechanics over a long period of time that start to break down.
Got it. Thanks for sharing that. So it sounds like compensation is essentially your body's doing its best to kind of operate under unideal circumstances. Is that right?
Yeah, that's correct. And because your body will do whatever it can to be in no or as little pain as possible, whether that's walking backwards, sideways, That's why you see people, they're hunched over, or you see them favoring, or they're limping, and their body's trying to get them to function as best they can with as little pain as possible. But obviously, that's not normal movement. And when we start doing that for a long time and we train our body to move that way, that's where we start getting into really long term, possibly permanent issues.
Yeah, our bodies are so amazing in that sense. Like, it's able to adjust and adapt, even though we're kind of like abusing it in a sense, like in so many ways. It's like it's so resilient. And I think that's an important belief to take on because that means if we operate like that, then we can actually heal, and awareness is the first step.
Yep, 100%.
So you work a lot with the cervical spine. So can you define what that is, and also like perhaps like the difference between lumbar, thoracic, and cervical, like just so people can understand what that is?
Yeah, so really all those terms just mean different parts of your body. So cervical means neck, thoracic means mid back, and then lumbar means lower back. And typically the way that we kind of delineate between the two is neck is going to be anything above your shoulders, typically. Thoracic is going to be anything where the ribs are, and then lower back is below the ribs and kind of like above where the hips are. So those are kind of those three areas.
Got it. So in terms of the cervical spine, I know you work a lot with that, but is there a specific part of the back that you notice is in most pain for the majority of people? Is it like a certain thing, or is it kind of dependent on the individual and the situation?
It definitely depends on the individual and the situation, but one thing I will say is that when someone comes in, let's say we're having neck issues or low back issues, if it's been there for any period of time, like over a month, there's going to be some involvement in one of those other areas, if not all three. So we always have to check everything. And the reason for that is really, again, going back to the biomechanics and posture. If we have something that we have normal curves in our spine, they should curve a certain way. When we start changing the way that our body, our curves are due to muscles being spasmed or an injury, and we start kind of redefining the way that we move, that means that other areas have to change because we have what's called righting reflexes. That's what keeps your body upright, level with the horizon. And when things start to change, we can't walk with our head tilted. If we do that, it's going to throw off our righting reflexes, and that's where we're going to potentially fall or even get some dizziness, nausea, that type of stuff. So anything that starts changing that, that means that the other parts have to adapt. So you're not walking, because if we have a low back issue, let's say we have an increased curve, we're not walking with our back like backwards like this, because that's going to make us want to fall over. So then what happens is that your body will then increase the curve of your neck the opposite way to then kind of keep everything lined up, even though now we're creating potential long-term issues because we're dealing with a short-term, or what your body sees as a short-term problem.
Got it. Thanks for sharing that. So if people are experiencing abnormal curves in their spine, like as you mentioned, like their curves that are supposed to be there aren't there, is it possible to get those back?
Yes, it definitely is. It just all depends on how severe it is. So one thing's that like when we have bone spurs that are there, we unfortunately can't get rid of bone spurs. So the ultimately what will happen with the spurs that when we have abnormal curves, your body is basically taking some of the bone mass from the center of the vertebra, putting on the outside to kind of increase the surface area, but that ends up in points. And eventually those points will fuse to the vertebra above or below. So if there's fusion done, we can't do anything. That's why it's so important to get checked out as quickly as possible. Because I've had curves where we've had complete reversal curve of what should be normal in the neck, and we've gotten it to be 100% normal after treatment because we caught it at the right time.
Got it. So it sounds like catching it at the right time and not like letting things go too far off, right? And as you mentioned, it's like if we have a specific pain point in the body, it's going to affect everything else at some point. So you don't want to lead it into this chronic state because everything is interconnected. Do I have that right?
Yeah, 100%. And I can't tell you how many people I've had come in who've had chronic issues. We're talking, for years. And it originally started with, let's say, their low back was bothering. And now the reason they come into the clinic is their main concern is their knee. Well, their knee wasn't injured, but because of the way that their body was then moving and holding weight to try to take pressure off the low back, it put increased pressure over one of the knees. That starts to break down. So now we have two issues. So what we need to do is work on this as a whole body movement biomechanical problem, get those things corrected, and then everything starts to get better.
That makes perfect sense. I mean, so if someone is, just experiencing it, I imagine that's like a different treatment than someone who's been experiencing it for a long time. And if it's chronic for some people, is that still possible, or does it just take longer? What's your thoughts on that?
Yeah, I mean, it's definitely possible to get improvement. We just have to evaluate and see, A, how long has it been there? What's the severity? And then what can we reasonably expect to improve? And where are our outcome measures looking like? And I can never tell that just talking with someone or their history. Because sometimes, I've had people in that are in great shape. They work out, 3, 4, 5 times a week. They come in, their body was in such good shape that they were able to compensate for more issues, and they had severe arthritis degeneration that was there. So we had less to work with. We can still get them better, and again, their body can compensate for more, but the degeneration that was there was much more than I had anticipated based on what their symptoms were. Then I've had someone come in who had 4 different ATV accidents over the last 6 months, came in a neck collar, couldn't move his neck. We took x-rays, everything was perfect, and he was back to normal within 2 weeks. So you just never know. That's why the examination is so important, and to make sure that we're doing a thorough exam, not a quick just exam, but taking our time to look over everything to find all of the potential issues so everything gets better at the same time.
That makes sense because awareness is so important. Like to have like a light shine on what's actually going on because that can be a huge relief for people, I imagine, right?
Yep.
Out of curiosity, like what does an examination process look like, and like what are the steps moving forward typically for people?
Yeah, that's a great question. So I'm much more thorough with my exam because we have to make sure we get to the right cause of what's causing the symptoms. So the first thing we'll do is I'll take a consultation. We'll go in deep depth on what the issue is, what they felt, what they've noticed, how long it's been there, what changes, what they've tried. I'll get all the background. Then I'll go through, and the first step is I just kind of feel the area. I want to see if there's any kind of muscle guarding, tension, any change in skin color, anything like that, any swelling. Then we'll go through and we look at range of motion, and we actually measure it. Don't just use our eyes. We'll actually use instruments to get range of motion because we want to see how things are moving. From there, we'll do some orthopedic tests to see what joints or what areas are the ones that are causing issues or potentially have problems. And then we check things like muscle strength. We test dermatones, which is sensory, because no one's come into my office and said, Doc, yeah, the inner part of my arm I feel like is a little off. It feels a little more numb than the right part. Now, if they come in with complete numbness, that's different, but we're talking about these minor changes. People never tell me that, yeah, Doc, the reflex in my left knee is decreased compared to my right knee. So we want to check all of these different things because if they're positive, it tells me where the problem is, and depending on what we find is what kind of treatment would work best. So we do all these different things. This way we kind of narrow down. We start with a very large scope of what could be going on. We start narrowing, and then from there we know where we can take imaging, what images we want to take. Do we want to take motion films? Do we want to just take static films? This way we can tell, again, in detail what's going on and create the best kind of treatment to work on those specific findings.
So it sounds like really pinpointing the issue to get the accuracy. Is that right?
Yes, 100%.
Awesome. So you mentioned range of motion. I think that's a really important concept because I find so many people are just so stiff. And there's a difference between flexibility and mobility, right? Both are important, but that mobility is a range of motion, right? And getting that can be so useful for people. Do you want to explain that a little bit?
Yeah, range of motion is huge because when we start losing range of motion, it's due to something. It could be muscles, it could be the joints themselves, it could be some degeneration. So we want to find out if we're losing it, what's causing it. But when we start to lose that, what then happens is it makes your muscles have to work harder to try to compensate and kind of make up for that lost motion. But it also potentially puts pressure on the nerve fibers that exit, which means we're going to cause issues wherever those nerves go to. Now, the other thing that's really important about range of motion, and a lot of people don't understand this, there's a difference between segmental range of motion and global range of motion. Now, here's what I mean. Let's take your neck, for example. When we take range of motion of your neck, we use instruments and we'll put one on top of the head and one back here, and we'll have them bend forward. That's giving us global range of motion of the neck. But when we actually take motion films, films of them bending, we can measure each individual segment, each vertebra, and how much it's moving to see if those are moving normally. Because what you can happen is we can have normal global range of motion, and then when we actually look at the segmental, let's say each one's supposed to move at 10 degrees. So let's say one is moving at only 6, one's moving at 14. The one that's moving more potentially has ligament instability or some instability allowing it to do that. The one that's moving less has issues as well. And we wouldn't have known that if we didn't look. And that again tells us that there's issues going on that need to be corrected, or things are going to start to kind of break down at a relatively quick speed, unfortunately.
Also, I never heard that difference between the ranges of motion. Like, I was pretty specific because, as you mentioned, like so many of us, we have certain joint issues, and it could potentially be from another joint upstream or downstream. So just kind of having that global range of motion, and yeah, I think that's important for people to understand as well.
Yep.
Out of curiosity, like what can people do to improve the range of motion? I'm sure there's many tactics, but is there anything that comes to mind for you?
Yeah, I mean, there's two big things. And again, I have to preface this by saying that we have to make sure that there isn't something underlying that's causing the loss of it, because that doing these things could potentially make it worse. The first is going to be examining your posture, and especially posture when we're dealing with electronics like our phone, tablets, and things like that, watching TV, and then if we're on the computer or when we're working. Making sure that we're not, leaning forward like this, making sure we have proper biomechanics when we're at our desk and our keyboard, making sure everything's at 90-degree angles. And then also, we can do some stretching if muscles are tight and tense. So the biggest thing too is when we look at these, we have to understand, is the problem just that we have just some tight muscles and we need to do some stretches? Or is the problem that the muscles are tight because they're compensating for something? So if they're just tight and they're tight from, let's say, bad posture because your computer screen is set up over to the right, you're constantly like this all day, and then you start to notice you're getting some neck pain. Well, if it's early on, we can do some things. Change where the computer is set up so we're looking straight ahead. Center of the monitor is right where the center of your nose is. That's going to be a huge change. And then we can work on some stretches, or even doing things to where it's like, hey, every half hour, 40 minutes, we get up, kind of do just some movement, reassess, retrain, get everything back to where it should be, reset, and then go back to the computer. Because there's almost no way that someone can work in one position for more than an hour, 2 hours, and maintain proper posture. Our body just starts to get a little bit tired, muscles start to get weaker, we start to lose it, and then by the end of the day, that's why we start to notice we got issues. So stretching and then also just looking at our normal posture throughout the day are two great ways to work on range of motion.
Awesome. So taking those movement breaks during our work sessions can be really helpful. Is that right?
Oh yeah, it's huge, and it doesn't matter whether you're sitting, you're at a standing desk, you just don't want to be in the same position for very long, even if it's just shuffling back and forth, not even standing up, just moving a little bit, moving your shoulders back, resetting. That is huge and can actually help prevent issues as well.
Yeah, help you be more productive and focused too.
Yep.
So, do you take in consideration difference between a standing desk and a working desk? Like sitting, standing, like what is your take on that?
It really depends because, again, you shouldn't be in one position for very long anyway. I will say that in my experience, the desks where you can go back from sitting and standing are typically the best because you have more adaptability. Because some of the sitting desks, it really depends on the chair. Can you get the chair height the right way to where your knees are at 90-degree angles, arms are at 90-degree angles with the keyboard? Sometimes you can't do that with either the way your chair is or the way your desk is. Standing, sometimes they put it up too high. Sometimes a standing desk is great, but because of the way that there's no keyboard area, your now arms are out like this, which is putting more pressure on your shoulders and your neck too. So neither one is perfect, but each have the ability to be much better. We just have to make sure we kind of take into account all those different factors with it. So really, as long as you have as much adaptability and ability to kind of alter these things as possible, you're going to be okay. Typically, standing desks that can be moved offer the best flexibility, so I like to go with those. But you could make anything work as long as you get those parameters set up properly.
Got it. So kind of having a mix, right? So we're not like stagnant and getting those angles, right? So we're not just kind of like in this strange position for too long, and we can kind of self-correct and be more mobile. Is that right?
Yep, 100%.
And you had mentioned like our posture, being more mindful of that during the day. And I think that's important because you're kind of training your nervous system and your body to be in correct posture. Because a lot of us, we just kind of, we have no awareness whatsoever. And it's really kind of leading to downstream effects. So I'm glad you mentioned that too.
Yep.
So when it comes to mobility, are you a fan of things like foam rolling, like soft tissue massage, like myofascial release? Like, what's your take on that?
Yeah, I mean, I think they all can be very, very helpful and have a great place. However, just like anything else, we want to make sure it's safe first. And the other kind of issue is, like, even let's say take a foam roller. There are so many different kinds of foam rollers. Some are thicker, some are thinner, some are more hard, some vibrate. So it just kind of all depends. My kind of rule of thumb with foam rolling is, especially if it's a harder or more dense one, you don't want to use that directly over the spine or any bone because it's going to be tender, especially ones that vibrate. The vibrate ones are harder, and they work more on extremities, so like arms and legs and things like that, to where you're not putting as much pressure. But ultimately, the end goal is if you're using it and it hurts, you should probably stop. Just listen to your body. People get into problems when they try to force through, like, oh, this foam roller should be great, I'm going to just keep using it, or I've got this massage tool, this is hurting, I'm going to put more pressure on it. Yes, we want to get some results, we want to get some relief, but we don't want it to come at the point to where now you're sore for 4 or 5 days after and you can't do anything. It's much better to do less and be able to do something each day than do so much one day that now you're out of capacity for 4 to 5 to 6 to 7 days.
Yeah, so there's a lot within that. So it sounds like it's a skill, right? We don't want to kind of do this pain area and get worse from it, right? Because there's a balance to it, and it's like having a schedule to it. So kind of like being aware of how you do it, and perhaps activities around it, so you know what to do in a sense. So just kind of working that and making progress every day. That's what it sounds like.
Yeah, and I will utilize those types of things in my treatment and even give people those things to do at home. But I make sure to explain exactly how to use it, when to use it, what to look for, what to feel for, and when to stop. Because we want to make sure we're not making it worse.
Yep, that's a good point there. So there are people with long-lasting injuries, right? And what is your approach to that? Because I feel like we can heal, but there's so much like kind of obstructions and things like that after a long period of time. So, yeah, what are your thoughts on that?
Yeah, so when we have long type injuries, I look at it in two different ways. A, we want to see where are we at today and where were we at in the beginning? And then B, is there something that could be going on that's either not been diagnosed or missed or not looked at as to why they didn't get the results so far? So we look at those different things and we want to make sure we're attacking this from a different standpoint. Don't want to be doing the same thing over and over again that they've already tried that didn't work. That's the definition of insanity. So we want to make sure we're doing something different and looking at this from a different, unique perspective. So, for example, one thing I have found in a lot of people who have chronic injuries, especially when it deals with the neck, that they have not been able to heal from, is A, biomechanics, but really it comes to ligament instability and ligament injuries. Those are a specific kind of thing that have to be looked for. If you don't know how to look for them, you're not going to find them. And a lot of doctors, a lot of PTs, PCPs, primary care doctors, they don't know anything about this. This isn't their realm. They don't deal with it, so they can't find it. There's specific tests that have to be done, and if they're not worked on the right way, they will never heal. Ligaments themselves potentially never heal to 100% anyway, so you have to make sure they're treated a specific way, or things will just get worse and worse and worse and worse.
Yeah, it's just like specific types of injuries, and just kind of like being aware of that because I'm sure it's going to be treated differently. Even though there's some similarities within that, but yeah, so makes a lot of sense.
Mm-hmm.
Also, are there certain habits that we should be taking on to kind of prevent injury in a sense? Because it is so prevalent, but like, how can we start to kind of bolster that resilience? I'm sure we've talked about it a little bit, but like, is there anything that comes to mind for you?
Really, just making sure you're listening to your body. If things hurt or don't feel right, and we don't have an injury or issue already, if things are not feeling right, then that means that your body's telling you, hey, don't do this. So just listen to your body, especially when you're doing something like, let's say, a sport, or you're working out, or you're sitting in a new chair, or you're getting a new mattress. If something doesn't feel right, don't force yourself through it thinking, okay, I just got to get used to it. Because if you're not used to it, it means one of two things. Either A, you have an underlying issue that needs to be looked at, or B, this new thing is not right for you. So there's no reason to kind of force ourselves through it. So that's really just listen to your body. If we have aches and pains, figure out why. Is it a certain position? Is it a certain thing? Or if we're trying something new and it hurts, just don't do it. Don't try to power through it. So just listening to your body is really the number one key. And when things hurt, if they don't go away within a week or two, they're not going to go away, and that's your key to go get checked out.
Yes, a lot of it pushes that pain, man, and it can be unfortunate sometimes. Like really kind of developing that somatic awareness in a sense, like learning to listen to your body and have this intelligence, and actually makes you much more resilient over time. And sometimes rest is needed,
Yep.
and sometimes it's more discipline to actually recover than it is to like keep on going. But it just kind of depends on the situation, of the person.
Yep. Yeah, and that is what we deal with a lot is some people just don't want to give it that time, and sometimes that time will save you more time in the future.
Yeah, I mean, awareness is key, and just kind of like knowing what you need in that moment, adapting your approach as we go.
Yep.
Another thing I want to mention on the chronic injury aspect is how people kind of we experience them for a long time, and it kind of affects our beliefs about it in a sense. So we almost believe that we can't get well. Do you notice that at all?
Yeah, it's so interesting when you start getting into the mental side of things, but that 100% can influence how you recover, but also potential more injuries that happen. You have to have that kind of mental awareness that hey, I can get better. I can experience some relief. There is some hope here. Because if you keep telling yourself no, 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 your body will find a way to make that happen. So we have to kind of have that positivity as well. Because if you're overall just having those negative thoughts about it, they will manifest physically. So we want to make sure we try not to do that, even though I know it's hard sometimes.
Yeah, because it can put you in a stress state or the fight or flight, which is actually counterproductive to healing. So just kind of being aware and just believing the process, trusting the process, and just moving from there.
Yeah, and that's a great point with the fight or flight. That's a whole other kind of topic and discussion. But when you're in that, you can't heal. So we want to try to do whatever we can to not be putting ourselves in that when we don't need to be.
Yeah, it's hard sometimes, man.
I know.
So another thing you mentioned is decoding pain, like because it's kind of like messages from our body. I think that's a great analogy because we just talked about a little bit about being able to kind of listen to our bodies and kind of assess it. It's a skill in of itself, man.
Yeah, definitely. So and that's a great point. So when someone comes in and let's say they have pain in this area, what we have to determine is the problem coming from that area, or is this area in pain because it's overcompensating from somewhere else? So that's why the tests are so important, and you can't just jump right to, okay, you have pain here, this is where the problem is. Because sometimes when we start, even with the consultation, the questions, we go back, I can start to see a pattern of, okay, well, your hip might be hurting now, but this originally started from an issue with a whiplash injury from 5 years ago from a rear end collision. And then things just started to kind of go from there, and you adapt and you change, and now we're at this point. So we kind of have to backtrack because if we just focus on, okay, your hip's hurting, that must be where the pain is, and do treatment there, all we're doing is chasing symptoms. We're not getting to the bottom of what's causing the symptoms. And if we just keep chasing symptoms, you're basically doing the same thing as just taking an aspirin. You'll get some relief for a little while, but the problem's still there. The problem wasn't that your body needed aspirin. The problem was that something's triggering that pain sensation, that nerve, and that's why we're having that pain sensation. So we got to get to what is triggering that nerve, what is making that nerve fire, why are we in this pain situation, and work backwards from there.
Yeah, getting the root cause is key. Is there something that people can be aware of, like to know where the pain is coming from? Because a lot of times we think it's in that spot, but how do we know if it's in that spot or if it's somewhere else, upstream or downstream? Is that just for the test, or any other way we can possibly know that?
It is hard to do without doing proper testing, but there's a couple of things that you can do is that look back at your own history. If you know that you originally had a problem somewhere else or an injury, and then now we have something new pop up and there was no injury, it's probably related to the older issue. The other thing is that you can also look at how you are moving, standing, or if you put pressure over one area, what triggers the symptoms. So even though you might have pain, like let's say a headache pain that goes across the top of your head, but you find that when I put pressure on the back of my head, right below the skull, all of a sudden that headache is triggered, the problem's probably coming from somewhere else, not the headache itself, if we're able to trigger it by putting pressure elsewhere. So it can be difficult to determine yourself. That's why you have professionals. But those are some things you can kind of at least attempt to look for to see.
Got it. A lot of people also experience like things like accidents or some severe injuries. Is your approach different for that? Like, what are your thoughts?
Oh yeah, if someone has had a major accident, injury, or trauma, then we have to be even more thorough than we already are, because we have to make sure that we don't have concussions, brain injury, post concussion syndrome. We don't have potential ligament tears, broken bones, fractures. So we have to look at all these different things, and that's why the tests are so important. And you shouldn't go to a doctor who just wants to skip through and get to treatment. We want to make sure everything's safe first. So I work with lots of other doctors and specialists. We refer out all the time, but we want to make sure that if we're referring, we have a specific reason for referring, because we don't want to waste the other doctor's time either. So they'll go with a full report, give them a call, hey doc, we're referring for this reason, we think this is the potential, this is why we want to look at them, this is why we're sending to you. Doctor then will give us a report whether it's something that they want to work on or they want to send back to us for treatment. But it's always about putting the patient first. So especially with those severe major traumas, we want to make sure everything's safe and we get to the underlying issue and what the problems, what's been injured is. That way we know the right path, whether that's through us or through another doctor.
Got it. That makes a lot of sense. So in regards to injury prevention, and we talked about a little bit, but is there anything else you want to mention so people can be more resilient and more kind of like robust in their physiology so we can just not experience so much injuries in our life?
Yeah, I mean, some injuries obviously we can't do anything about because other people are involved with those. But when it comes to ourselves, not overdoing it. If we're doing an activity that we haven't done in a while, making sure we're taking proper precautions with stretching, and then listening to our bodies. If, let's say, we want to start running and we haven't run in a while, if we start to notice, oh, this is starting to hurt a little bit, just stop. Document how long you did before it started. Now you at least have your starting point, and then you can kind of go from there. But it's when we try to push through things, don't listen to our body, that's when we start getting injuries and problems occur.
Yeah. You want to talk about running a little bit? Like, what's your take on that? Because I feel like a lot of people get running injuries and they're kind of like beating themselves up in a point. I mean, I think running can be great for some people, but I feel like, a lot of times we're just doing it unnecessarily in a sense. And it's kind of surprisingly taking away from our health. Do you want to speak to that a little bit?
So running is one of those weird things to where, yeah, it can be good for you, but a lot of people do it improperly. And when we talk about running, a lot of things go into it. First, proper stretching before, but you can't overstretch your body. So if you haven't been doing this a while and haven't been stretching, don't stretch to the point of where now we're pulling muscles. So you want to make sure you stretch properly. Have the right kind of footwear is really important, and then also the surface you run on. A lot of people don't realize it, but potentially one of the worst substances to run on is a sidewalk. Cement has the least amount of give. It's causing that shock wave to go back through our body, so now we're potentially putting abnormal pressure over our knees and hips and just every joint that's weight bearing. But also, we need to be careful about running on grass. This is where a lot of injuries happen because grass isn't always flat and even. There might be a hole here. There might be, a grass root you don't see. So now when we kind of get into our groove and we're going, we can potentially twist an ankle, fall, or not see a hole that's there. So you want to make sure you're very, very cognizant of where you're running in the surface as well. And then again, just not overdoing it. If you kind of follow those things, then we take some of the risk out of running and we can get the benefits. So it's really just a lot of human error.
Yeah, I love it. Being mindful of the terrain, right? Because, I feel like terrain is so important because I feel like getting grass and all these things, like you mentioned, we have to be mindful of these things so we don't hurt ourselves. But at the same time, like, if we're just walking on flat surfaces all the time, our stabilizers or muscles aren't working. Right? So getting these different movement inputs, and these are just little things that people don't necessarily think about. What are your thoughts on that?
Yeah, definitely. And I mean, when we come to surfaces, if we want to talk about the best absolute surface to run on, it's going to be going to like a track because that's designed to run. It's designed to do that. It's boring. I get it. It's boring, but that's really where we're going to have the least amount of potential issues with the surface. But yeah, that's one thing that with surfaces, one of the big things that I see too is when people are running on them, it's really when it comes to their footwear, going to your point about different stabilizers, they'll be running on shoes that are so worn out that on one side, the inside portion of their arch, there's just no arch support left. So now you're basically creating instability every time you step. Or they wear shoes that are not the right size. Or some of these shoes that are out there have these huge increased heel height because they're trying to take away some of the compression forces that go in the rebound forces. all of that can potentially affect the way that you're moving. So it's one of those things. If you want to go out running, that's okay, but start slow. Don't try to run, a mile if you haven't gone out and run in years. Maybe do one lap. Or if we're trying to run a mile and you've been running, all of a sudden don't go and sprint for the first, the all 4 laps to do that mile. We just want to make sure we're doing it right and safe, and it should be your way of doing things long term. Because if you're using muscles you haven't used in a while, they're going to be weak. They're going to give out, and if you force through it, you're either going to have an injury or you're promoting abnormal movement patterns, which are going to cause problems later on. So you just have to make sure you're doing everything smart, and sometimes we have to be patient about it.
Yeah, definitely. Like being mindful of our footwear and not heel striking as well, because a lot of people do that. It's totally unnecessary.
Yep. Yeah, that's and two, that's a great point. If we have abnormal gait and we're going out running, again, now you're reinforcing abnormal gait, whether that's toe turned in, or turned out. All those different things can cause issues. So you want to make sure you're doing things safe.
Yeah, you want to talk about gait a little bit because that's a really important point as well. Just being mindful of how we're walking, our strides, and all that.
Yeah, gait is really, really important because if we're not walking, if nothing else, if we look at this from a very simplistic point, we want to at least be equal right side to left side. If we're different, then that means that we're using muscles differently on our right and our left, and we're going to cause even more problems. So at least, as long as we're even, we're at least better off than we were if we're not. But again, like if we're walking, let's say one foot we're heel striking the whole time, and then the other side we're walking on the outside portion of our foot, that's going to cause problems. We're going to be putting abnormal pressure on part of one knee versus the other knee, which means we're going to start reinforcing osteoarthritis in that knee from that weight bearing and the way that those forces are going up. So we have to make sure we're doing it the right way. And the way that you walk is different than the way that you run. And a lot of people don't realize that too. And then also just even when it comes to the footwear, if you're running straight ahead versus if you're running and doing quick stops and cuts, you're going to need different kind of grips on those shoes in order to make sure that we're not going to have falls and things. So there's a lot to take into account. So if you're just starting out, sometimes it's safer just start on a treadmill and go slow.
Yeah, man. Another thing in terms of injury prevention, I would imagine nutrition plays a big role because our bodies are literally made from the food that you eat. You want to talk about that a little bit?
Yeah, nutrition is one of those things that a lot of people are interested in, but very few actually take to heart. Nutrition labels are out there, so we can kind of look at that, but I know that sometimes it's quicker and easier to eat something that isn't as healthy. So what I always tell people is if you're worried about that, one of the easiest things you can do is start taking multivitamins. Start making sure we're getting those vitamins and nutrients into our body and making sure we're drinking water. Most people do not drink enough water, and when you do that, you're basically not only dehydrating your body, but you're dehydrating your muscles. So now your muscles aren't working the right way, and we're putting ourselves at risk for potential injury too. The vitamins help us heal when we have injuries and help our immune function. So if we're depriving ourselves of those things, you can potentially get all the vitamins you need from proper nutrition. But it's hard, and you have to make sure you're really watching everything. So at least if we're supplementing it through vitamins and minerals and making sure we're drinking enough water, we're going to be much better off than most people are at this point in their life.
Yeah, water is so important. You mentioned multivitamins. Is there anything that people should look out for when they're purchasing them? Like, what should people be aware of generally?
Yeah, so first of all, when it comes to multivitamins, we have to understand that there's two different types of vitamins. There's water soluble and there's fat soluble. So what that means is that if you have an excess of water soluble vitamins, you're just going to urinate them out. So it's a lower risk to overdose on them. It's harder to overdose. Fat soluble, they are stored in our fat cells, which means we don't get rid of them as quickly. So you have to make sure that you're not overdosing on them. Now on the vitamin actual package, it'll tell you what the daily dose limits are. But potentially what you have going on, your doctor might say to go over that for a short period of time if your blood count, when you do your blood test, if you're under certain levels. Now the other thing is that what most people don't realize, vitamin A is vitamin A. What I mean by that is that a vitamin A in this one is typically the same as vitamin A in this vitamin. However, the way that they either get that vitamin from wherever they're taking it from and what they encapsulate it in is where the big changes are. So I like to use vitamins that have vegetarian capsules that are easily digestible in the stomach instead of the hard ones like a Centrum vitamin you might use. those they save their money and the vitamins are cheaper because of what they encapsulate them in. So you're basically sometimes not even getting those nutrients. There's been times where they've done studies and with the Centrum, it'll show up on an X-ray in someone's stomach and they never even digest it. So you're paying for vitamins, but you're not getting it because your body can't break down what's holding the vitamins in. So that's keep that in mind. A lot of the cheaper vitamins that you get at like a Walgreens or a CVS, they're cheap for a reason. You're not really getting what's in there. So sometimes, even though it might be a little bit more expensive for this vitamin, you're actually getting every little bit that you're paying for. So you actually save money in the long run. So you just have to do your research on different vitamin brands because there are so many out there today.
Yeah. So you just want to buy something, you actually want to make sure you can digest it and assimilate that. That's important.
Yep.
And as you mentioned, it's very hard to get our nutrient bases covered just with like the kind of terrain of our food these days. So yeah, it's definitely supplements are kind of important, and just mindful supplementation based on what you need is key.
Yep.
Yeah, we can make our bodies out of like Cheetos, or we can make them out of grass-fed steak. And the choice is ours. I wonder which one is going to be more like injury preventative, right?
100% right.
Yeah. Along the lines of supplementation, like, because we talk about listening to our bodies a lot, like, is there anything that comes to mind that you would kind of recommend generally, or is it always like a systemized approach depending on the situation? Like, what's your take?
Yeah, I mean, the biggest thing is everyone should be on multivitamins and omega-3s. When it comes to omega-3s, it's very hard to get. We should have double the amount of omega-3s as omega-6s in our diet, but the way that food's processed, it's the opposite. So you almost have to take an omega-3 to get up to there. And the difference is omega-3 is those fatty acids that we use to help fight inflammation, where omega-6s put us in an inflammatory state. So by doing these things, again, if we're more deflamed, we're less likely to have an injury. If we're having the right kind of supplements, we're less likely to have an injury because we're operating at our best potential. If we're hydrated, we're less likely to pull something because we're hydrated. So all those things just give your body the kind of the foundation it needs to prevent injury as best as we possibly can.
Yeah, those omega-3s and omega-6s are super important. And with understanding that, as you mentioned, one is anti-inflammatory, one's inflammatory, and they're both needed, but it's more so about the ratio. So the problem, man, is most of us are walking around with like ridiculous amounts of omega-6s. Like it's like a 20 to 1 omega-6 to omega-3 ratio, and it should be like a 1 to 1 or 1 to 3, and which is really the basis of chronic disease, the inflammation, and primarily from these seed oils that are kind of super highly processed too.
Yes, and that's the thing too with a lot of the oils. You really have to look at where they're coming from and what you're paying for and what you're getting, because we're finding that a lot of these seed oils aren't as good as they were originally said to be. So you just have to kind of be careful. You have to really ask yourselves, am I really hearing about the nutrition and how good this is, or is this more of a marketing campaign to where someone's trying to get me to buy this?
Yeah, it is marketing in a sense because if you look at them, they call it vegetable oils, but none of them are from vegetables. They're all seeds and grains and things like that.
Right.
Now, like it's okay to eat the foods depending on the person. I'm not going to say they're right for everyone, but when we take these foods that are very hard to get fat out of and we make them go under 40 to 60 steps to get processed, each one requiring one factors, bleaching, degumming, deodorizing. It's absolutely insane definition of a highly processed food, and this is really the number one thing I believe we should actually remove from our diet.
Yeah, you're 100% right. And they're starting to get better about putting on labels how processed things are and what's added. Unfortunately, they're allowed to use some very complicated language to where it confuses people as to what it actually is. But hopefully we're getting to the point. Honestly, it all comes down to this. If you're confused, less ingredients, the better. Less things listed, the better. The more stuff listed, and if you can't pronounce it, it probably shouldn't be in your body.
Yeah, eat real food. That term is called greenwashing, right? We kind of make it look like these things are healthy, but they're really not. Like saying, certain cereals are heart friendly when it's just total nonsense. It's based off some epidemiology, which is kind of totally indirect, and it makes people kind of like, oh, this is good, but it just, man, it's a lack of consumer awareness sometimes that these marketers take advantage of, unfortunately.
100%.
And you mentioned water. I would like to get your approach on like filtration and things like that because it's so important. Like, because again, it's not just what we do; it's how we do it, and the quality of things really impacts our outcome in a sense.
Yeah, so it's really hard. Nowadays, we've gotten into a problem with water to where you can almost find some study telling you that this way is better than this or this way is bad. So none of them are going to be perfect. Some of the best is going to be if you have your own reverse osmosis type system in your house. That's going to get out the most stuff. Tap water is some of the worst water you can drink. And again, if you go and you buy bottled water, again, water from a bottle is not the best. You have to make sure that bottle doesn't freeze. I've seen people throw bottled water in their freezer, and that's just the worst thing you could do, because if there is any contaminants in that plastic, it's going to leak into the water. Same thing if it's in a hot car. So you have to be very, very careful. Any filtration is going to be better than none, but some is going to be better than others. I would rather people drink water and not worry than not drink water because they're so worried. And then if we get to the step to where it's like, okay, well, which one's better? Then we can start researching, well, what possibilities do you have? Some people can't put a reverse osmosis system in their house. Some can. And then when we talk about when they're buying water, there's differences of there's purified versus spring versus the mountain. And some of these are all just marketing terms too. So it just kind of depends, because some is not available in your area. And then also, if we're like, let's say we're getting some ordered, how long does it take to get here and where's it shipping from? If you're in Florida and it's shipping from, Seattle, that's a long time for it to be shipped and on the truck or the plane, and then we have a potential heating issue. So there's lots of stuff you can kind of consider and look at. So the simplistic thing is drink more water, try to avoid tap if you can, and then from there, if you can purify it or use something, even a Brita filter, something like that, any filtration is going to be better than nothing. But if you have to stay away from any water, you want to stay away from the tap water.
Yeah, man. Like, I like how you mentioned, just don't worry about the quality if you're not drinking water. First, drink water, then do that, right? Like, a lot of people, like, we focus on perfection instead of progress. And I like to say, like, if you switch out your frosted flakes for conventionally raised eggs in the morning, that you're winning. They may not be perfect. Pasture raised is ideal, but you're winning. You need to celebrate that. Celebrate those small steps every single day and go from there.
Yep, that's true.
Yeah, and in terms of the reverse osmosis, I think I'm glad you mentioned that, because that's what people need to know is, like, it takes all the bacteria, all the things like the chemicals, all that out of the water, which is great, but it's kind of left with this blank slate in a sense. So there's no minerals in it, which is unfortunate. But adding those minerals back in, like with high quality sea salt, things like that, can really help us kind of amplify that water as well.
Yeah, and that's the thing is, I don't think any one way is perfect, especially because everyone's just so different. So like you said, just as long as you drink it, you're going to be better. I always like the phrase when it comes to doing something and you can have, when you can overanalyze things to where you get paralysis, it's just done is perfect. Just do it. Drink more water. Drinking more water is better than not. And then once you get in there, if you want to start worrying about what you're drinking, you can go from there. But just drink more water and you will be in a better position than if you're not drinking any water.
Absolutely, man. Dr. Decubellis, is there anything that you would like to get out to people in terms of wellness or chiropractic, or have we covered it? Like, what are your thoughts?
I think we covered a lot of stuff. I mean, I look at things, and the underlying factors that really affect you are movement, and then what you're putting in your body. So if we work at those two things and have proper hydration, proper minerals, we have a good diet, and then we're moving the right way too, you're going to not have issues. That's where we end up with the problem is really, and it comes a lot with movement. There's a huge integration between movement and also even mental thought. It's really interesting how all these things go together. And it's kind of interesting when you think about it. Have you ever seen, it's very hard to see someone who is moving properly, is able to function and not having pain, and then them having severe negative thoughts. But you've seen people who have severe negative thoughts, they don't move as well. They hunch forward. They have bad posture. Because these things are intertwined and linked. So we want to make sure that we're doing our best that we can control as well.
100%, man. Everything is connected for sure. All right, this has been amazing. I really appreciate you coming on, sharing your story, your insights with us. It's been invaluable, really, like understanding our bodies so we can kind of go from there in a sense, because I feel like education is power. And of course, like knowledge, not power, knowledge applies power and wisdom. So apply what we can here and kind of go from there. I really love the nutrition aspects we talked about because it's so key. And again, it's not about perfection. It's about progress and going from there every single day so we become the most empowered, greatest versions of ourselves. Again, man, I appreciate you. And if you want to get connected with you and your work, where can we go?
Yeah, and thanks for having me. Best way to get connected with me is you can reach out through my website. It's chiropracticdownersgrove.com. Or you can give us a call, 630-435-6461. I'm always open to answer questions if people have questions on what they should do. So I'm always open for questions on any of these different kinds of subjects.
Awesome, man. Great. Appreciate you.
Yeah, thanks for having me.
Definitely.